Hello everyone, another video for ultrasound physics, and today we'll talk about the ultrasound hybrid imaging, or which sometimes is called the real-time virtual sonography, RVS. The concept of hybrid imaging is not strange to the field of imaging. There are different modalities that can be added together in a hybrid way. So it's not only ultrasound hybrid, there are different hybrid modalities like the PET with the CT, SPECT with CT, MRI with CT, and then we have the ultrasound with MRI or ultrasound with CT. What are these modalities? Just an idea. So we have the PET, which is positron emission tomography, SPECT, which is a single photon emission computerized tomography, CT, which is computed tomography, or sometimes called CAT scan, and MRI, which is magnetic resonance imaging. So these are some modalities that are already in the field that has hybrid. So what is the hybrid ultrasound? With one of these techniques, you must be added to the CT or MRI. Okay, so it's a technique that enables the display of two modalities, ultrasound, one of them, and the other side must be a CT or MRI. So how this technique of ultrasound hybrid imaging is done? The patient you are scanning currently has already been scanned by CT or MRI, and these data are saved or loaded to the ultrasound system, which is part of our workstation. Okay, when you are doing the ultrasound, the probe you are having is having a sensor, a magnetic sensor. This magnetic sensor is determining the location and direction of the probe in relation to a magnetic field that is being fixed to near to the patient. So in this way, the sensor can tell where you are in relation to the patient's anatomy. You are in sagittal cutting or transverse, axial, oblique, okay, coronal. So the cutting plane is detected by this positioning magnetic sensor. So this workstation monitor, the one that is is displaying the ultrasound that is being currently performed and the concurrent or the corresponding virtual reconstruction of the MRI or CT images. So you are having here on the workstation display two images. One image that is for the CT or the MRI that has been saved already, and in the meantime, you're having the ultrasound display, which is the current scanning right now. So why this technique, this complicated technique is obtained, or why they are thinking of it? What are the advantages of this complicated technique of real-time virtual sonography or ultrasound hybrid imaging? Okay, it increased the diagnostic accuracy because there are two techniques or two imaging modalities are showing the same spot, the same area, and you can see it. You have comparison between the two techniques. So you can see the same lesion by ultrasound, and the same lesion has been detected by the CT or MRI. And this will help also in precise monitoring of interventional procedure. For example, you are doing injection or you are having ablation performed, or you are having a biopsy. So all these techniques, interventional techniques that sometimes are done using the ultrasound as a guide, okay, this will emphasize the precise technique of having this interventional ultrasound performed. So as we have seen the advantage, but there are also limitations or disadvantages of this technique. Okay, number one, it cannot be used in patients who are contraindicated to have a CT or MRI. Second thing, It doesn't always correlate because that sometimes there is the correlation between the CT and MRI pictures. Sometimes they're not that accurate in correlation between the two images on the display. So correlation problem. Third thing, it prolongs the exam because it takes longer time to correlate the images and to upload the data and all of this. And to increase the cost. This is also increasing the cost over the patient. Based on the advantage and disadvantage that we have seen for these hybrid techniques, there are some limited applications. One of them uh, uh, is called the radiofrequency ablation, which is using a needle to char or to burn small lesions in the, for example, the liver or other parenchymatous organ in the body. So this technique is helpful in precise application of the needle. So it helps in guiding the needle precisely to the tumor area and to get in the center and open there is like an umbrella at this needle, the tip of the needle, there is some umbrella wires, and when they open it, and this will, with the electric current, they will char or burn the tumor inside. This technique is called RFA, radiofrequency ablation. The second thing, it will help also in the assessment of angiogenesis. Angiogenesis is simply how much is the vascularity of the tumor. For example, if you have a CT or MRI that is showing some angiogenesis or more vascularity, this can be emphasized also with the use of contrast ultrasonography or contrast enhanced ultrasound. In the same time that the machine is displayed the angiogenesis features in the CT or MRI. So this will also improve the diagnosis of angiogenesis or the vascularity of the tumor. Thank you and see you in another video.